3 nurses end up in hospital beds themselves after being exposed to a deadly drug while treating an overdose patient. Good evening, I'm Latricia Thomas.
And I'm Calvin Sneed. It happened in Ohio, and when healthcare providers in Chattanooga heard about it, they say they made an immediate plan to protect our nurses. Brittany Martin has spent the day speaking with one local hospital to see how they're preparing for something like this in Chattanooga.
It seems simple. To be careful when you take off gloves like these in a hospital. But now doctors at Memorial worry about a drug so strong it can be deadly just by touching it or breathing it in. Dr. Helen Kuroki says all of her nurses recently received new training.
We are teaching them that the powdery substance may be on their gloves, and to remove these gloves in a way such that it doesn't really touch their skin.
Dr. Kuroki heard about 3 nurses in Ohio who've been exposed to fentanyl while treating an overdose patient.
We considered it an emergency. We essentially stopped what we were doing when we heard about this article.
CHI Memorial immediately created a plan in case it happens here. In addition to changing the way nurses take off their gloves, every unit of the hospital now has Narcan set aside for staff.
It is a life-saving measure.
Narcan is a nasal spray that reverses an opioid overdose. Since North Georgia and East Tennessee are hot spots for drug abuse, Dr. Kuroki knows the risk is there. In the last year, she says the number of overdose cases at the hospital has dramatically increased.
Fentanyl is about 100 times stronger than morphine and used in areas like the operating room related to anesthesia purposes.
Chattanooga police say that drug is also being abused here in Chattanooga, and something even stronger. This picture shows a deadly dosage of each of these drugs. That tiny speck of carfentanil could kill several people. Carfentanil is an elephant sedative.
It's about 10,000 times more potent than morphine.
A scary thought, but Dr. Kuroki says they're ready for whatever comes through these ER doors.
That story from Brittany Martin. Dr. Kuroki says they're working on a new protocol that would keep patients and guests safe too. All 3 nurses hospitalized in Ohio are expected to be okay. CHI Memorial says they've never had an incident like that here.
Chattanooga